next point or next disease, that is your COPD. It means chronic obstructive pulmonary disease. This COPD, it means what? That is chronic obstructive pulmonary disease. It is also called as COLD. It means chronic obstructive lung disease. Then it is also called as chronic obstructive airway disease, that is COAD. Then it is also called as chronic airflow limitations or the chronic obstructive respiratory disease. I am repeating. See what is synonym or what is the another name? What are the another names for this COPD? First, that is chronic obstructive pulmonary disease. Then second, chronic obstructive lung disease. Then third, chronic obstructive airway disease. Then next, chronic airflow limitations. And then next, that is chronic obstructive respiratory disease, that is COLD, then COAD, then CAL, and last that is CORD. So these are the another names for this chronic obstructive pulmonary disease. Of course, it is disease which is related to our respiratory system. This COPD, it means what? Chronic bronchitis and the emphysema. Yes, what is it? It contains what? Both bronchitis and emphysema, a pair of two commonly coexisting diseases of the lungs in which the airway become narrowed. This lead to the limitations of airflow. Yes, I am repeating. This chronic COPD, it refers for what? First, that is bronchitis, and second, that is emphysema. This pair of two commonly coexisting disorders, sorry, diseases of lungs in which the airway become your narrowed, and this lead to the limitations. So because of this narrowing of your airflow, it will causes or it leads what? The limitations of your airflow and flow of air from the lungs. And due to these limitations of flow of air, it causes what? Due to these limitations, it causes shortness of breathing. Then in COPD, there is less airflow in and out of the airway because of one or more following reasons. There are few reasons for the limitations of the less airflow. First, the airways and air sac lose their elastic quality. I am telling that there are few reasons behind the less airflow. First, that is the airways and air sac lose their elastic quality. Then second, the walls between many of the air sac are destroyed. Then third, the walls of airways, it become thick and inflamed. Then the airways make more mucus than usual, which tend to clog them. Then next, I am repeating few reasons for less airflow. Airway and sac are lose their elastic qualities. Then the walls between the many of the air sacs are destroyed. Then next, all of the airways become thick and inflamed. Then airways, it produces more mucus than the usual or the normal, and which tends to clogging. Here we can see the normal lungs and lungs with COPD. Here we can see the clearly your normal lungs and lungs with your COPD. Here we can see the change. Then next we will see the causes. So what are the causes? First, that is smoking. Then second, occupational exposure. In that, first, exposure to the workplace dust found in coal mining, then gold mining, then cotton textile industry, then chemical industry, or the chemicals such as cadmium, isocyanate, and fumes from welding have been implicated in the development of your airflow obstruction. Then next, air pollution. Then sudden airway constriction in response to inhaled irritants. Then bronchial hyperresponsiveness is a characteristics of your asthma. Then next, genetics. Alpha 1 antihypertensive deficiency is a genetic condition that is responsible for about 2% of cases of COPD. I am repeating, the alpha 1 antitrypsin deficiency is a genetic condition that is responsible for about 2% of 2% cases of your COPD. In this condition, what is happening in this condition? The blood doesn't make enough of protein. Yes, what happen in this condition? Your blood doesn't make, it's unable to make enough protein. The alpha 1 antitrypsin unable to make your enough protein, and alpha 1 antitrypsin. The alpha 1 antitrypsin, it protect the lung from damage which is caused by protease enzyme such as elastase and trypsin, and that can be released as a result of inflammatory response to tobacco smoke. I am repeating here, in this condition what is happening, your blood doesn't make or unable to make enough of protein and alpha 1 antitrypsin, and this alpha 1 trypsin is useful, or what is the role of this? It protect the lung from your damage caused by different protease enzymes, for example elastase and the trypsin. Then we'll see the risk factors. Here we can see the risk factors of different risk factors of your COPD. First, that is cigarette smoking, then occupational dust and chemicals, then environmental tobacco smoke, that is ETS, environmental tobacco smoke, then indoor and outdoor air pollution, then nutrition, then infections, and socio-economic status. Then we'll see the pathophysiology. The abnormal inflammatory response of lung due to the toxic gases. Then what will happen? The response occur in the airways, parenchyma and pulmonary vasculature. Due to this, the narrowing of the airway takes place. Then due to this narrowing, the destruction of parenchyma leads to emphysema. Yes, that is emphysema. Then the destruction of lung parenchyma leads to imbalance of proteinase and antiproteinase. Yes, destruction of these parenchymas, what will happen? There is imbalance between your proteinase and antiproteinase. These proteinase inhibitors prevent the destructive process. What is the role of this? This proteinase, what it will do or it inhibit, or the inhibitors prevent the destructive process. Then there is pulmonary vascular changes that take place, that is thickening of vessels, collagen deposit, or the destruction of capillary. So what are the pulmonary vascular changes? For example, thickening of vessel, collagen deposition of collagen, or the destruction of your capillary bed. Then mucus hypersecretion, that it is hypersecretion of your mucus. It is because of cilia dysfunctioning, airflow limitations, and carpal monale, that is RAF. Due to this, chronic cough and sputum production. Then we will see next, that is clinical features. First, that is chronic cough. Then second, sputum production. First, that is chronic cough, then sputum production, then wheezing, then chest tightness, dyspnea on exertion, then weight loss, then respiratory insufficiency, then respiratory infections, then barrel chest. It means chronic hyperinflation leads to loss of lung elasticity. In simply, we can say that loss of lung elasticity. First, that is chronic cough, then second sputum production, then third wheezing, then next chest tightness, then dyspnea and on exertion, then next weight loss, then respiratory insufficiency, then respiratory infections and barrel chest. It means loss of elasticity of lung. Yes, as I said earlier, this COPD it includes two coexisting diseases, that is bronchitis and second that is emphysema. So what is bronchitis? It is a condition in which bronchial tube become inflamed, or the inflammation of your bronchial tube, or the inflammation of your bronchites. The acute and chronic. Acute it means short term. No, the chronic it means long duration or it is ongoing. The infection of the lungs irritant can cause a acute bronchitis. The various infectives or causating agent or the lung irritant it may cause the acute bronchitis. The chronic bronchitis is a ongoing or the it is a serious or it is a long duration. If occur in the lining of bronchial tubes, if it is occur, if the chronic bronchitis occur and the lining of your bronchial tubes is constantly irritated and inflamed, and it causes long term cough with a mucus. Yes, if in chronic bronchitis, it means if the chronic bronchitis occur in, if this it is occur if the lining of this bronchial tubes is constantly irritated and inflamed and causes long-term cough with mucus. Then chronic bronchitis it is defined as a presence of cough and sputum, presence of cough and the production of sputum for at least 3 months. We'll see the mechanism. First, irritant irritate the airways. Irritant it means it may be your causative agent. Irritate the airway. Due to this irritation, there is excess production of mucus. Then it causes inflammation. Then cause the mucus secreting glands and globulate cells to increase in numbers. It means the ciliary function is released, and due to this ciliary dysfunctioning, it may produce a more mucus, and due to this the bronchial walls it become thickened and lumen narrows and mucus plugs in the airways. Then alveoli adjacent to the bronchioles may become damaged and fibrosed. After the function of alveoli microsis, it causes infection. Then signs and symptoms, it may be acute. For acute signs and symptoms, then next that is chronic symptoms. It means acute sign and symptom, it means these symptoms for a short duration: sore throat, then fatigue, that is tiredness, then fever, then body ache, then stuffy or the runny nose, then vomiting, diarrhea, persistent cough. Cough may produce a clear mucus. Then shortness of breathing. I am repeating: first symptom sore throat, fatigue, that is tiredness, then body ache, fever, stuffy nose or the runny nose, then vomiting, diarrhea, persistent cough. Cough may produce clear mucus and the shortness of breathing. Then chronic symptoms: coughing, wheezing, then chest discomfort, and the coughing may produce large amount of mucus, and this type of cough often is called as smoker cough. Yes, what I am saying, in chronic symptoms, first that is coughing, then wheezing, then chest discomfort. The coughing may produce large amount of mucus, and this type of coughing may produce large amount of mucus, and this type of cough is often called as smoker cough. Then for diagnostic evaluation, history or medical history. Then in medical history, whether you have recently had a cold or flu, then whether you smoke or spend time around the other who smoke, or third, whether you have been exposed to dust, whether you have been exposed to fumes,